Welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. November is National Alzheimer's Disease Awareness Month, so we're talking about the impact this disease has on families. But before we get started, let's take a look at what's coming up on the show. Information about Alzheimer's disease and signs you should look for. Getting a new smile with the help of special technology. And how our daily use of cell phones is creating new aches and pains. We've got the fix. All that and more on this episode of Your Health. 5.8 million Americans are living with Alzheimer's disease, and here to tell us more is Terry Spitz, Executive Director of the Desert Southwest chapter of the Alzheimer's Association. Thank you so much for being here, Terry.
Thank you for having me.
First off, what is the mission of the Alzheimer's Association?
Well, first, it's to end this terrible disease. You know, we want to end Alzheimer's disease. We want to accelerate research, which we're the largest nonprofit funder of Alzheimer's and research in that area. We want to offer and enhance care to everyone affected, and we also want to really reduce the risk of dementia through brain health promotion.
Now, Arizona and Nevada are the top 2 out of 3 states for Alzheimer's growth. Wow, I was really surprised to learn that. Why do we think that is?
It has to do with a lot of age. You know, we have a growing retirement community in both states. So when you look at Arizona, we have 140,000 people living with Alzheimer's right now. So, and that number is growing. You know, as our state grows, in the next 5 years, that's going to grow to around 43%. Yeah.
So Terry, how does someone know if forgetfulness is due to aging or if there's something more going on?
You know, there's a lot of things that just come with aging, just those normal things like, you know, where did I put my keys? That's normal signs of aging. If I come in and I realize that I can't find them and I find them in the freezer, then that's a sign. You know, on our website, alz.org, there are 10 signs that people can look at and they can kind of compare what is normal and what is the average kind of thing when you're aging, and then what is something that's not right.
Oh, you actually have a personal connection to the disease. Would you mind sharing more about that with us?
When I came into this position, you know, our family was experiencing, you know, a family member that was going through dementia. I think what's really struck me the hardest is, you know, you think it's a disease that is mainly older people get it. And that is true. Age is a huge factor, over 65, but you know, there's also early onset. And you know, for me, knowing someone who, you know, got it at age 53 was really hard to even think that could happen, and to see a family going through that. So, you know, we have our story, but it's really all of the stories that are coming forward and people sharing of how they're dealing with it and how they're coping. It's a cruel disease, and it's something that we really need to work to solve.
So Terry, why is it so important that caretakers reach out when they need help and really to take care of themselves?
One of the things with caretakers is they can take on a lot of stress, and we want to make sure that they're healthy too. It is not an easy task when you're caring for someone who's going through dementia or they have Alzheimer's and they're progressing. And while you think that it's something manageable at the front end, it gets harder and harder. And we want them to know that they're not alone, that there is help if they do start, you know, seeing health problems, to make sure that they're seeing their doctor, that they're managing their stress.
Now Terry, let's talk about the research side of it. Is there any promising research on the horizon?
Right now, there is a global race to find a blood biomarker to identify Alzheimer's dementia. And when we're able to do that, we can do it earlier and find interventions and really try to you know, help those people earlier rather than later when the disease has progressed.
Well, thank you so much for being here with us today and sharing this important information. If you'd like more information on the Alzheimer's Association, just head over to their website. Looking at our cell phones or tablets all day is actually creating new health problems for us, but thankfully the doctors at Honor Health have some tips to deal with text neck.
My name is Kevin Kalsa. I'm an orthopedic spine surgeon practicing here in Scottsdale, Arizona at Honor Health Thompson Peak. My job entails basically seeing people for all types of spinal injuries, spinal conditions, degenerative conditions like cervical spine, thoracic spine, and lumbar spine. And then I usually see clinic 3 times a week, and I operate twice a week. And most of my surgeries are done here at Honor Health Thompson Peak. We're definitely seeing a lot younger people coming in over the past 5 to 6 years. Since the advent of the iPhone, and especially cell phones becoming much cheaper, has changed what we see in our office. I am seeing a lot more teenagers come in with their parents complaining about neck pain and low back pain than I did probably 5-6 years ago. And in the general public, that's what we have started calling text neck. Your head, which weighs approximately 10 to 12 pounds in a neutral position with a neutral alignment, and you bring that neck into flexion, and for every 10 to 15 degrees of neck flexion, your neck weight is actually doubling. So you have these little tiny muscles of your neck which are holding your head up. And approximately at 60 degrees of neck flexion, your head weighs the same amount as a bowling ball. So you have your tiny little neck muscles which are holding your neck, trying to bring them back up, and you're constantly doing that throughout the day with an iPad or a cell phone. So it kind of makes sense when you come in at the end of the day and you go home and your neck is just absolutely aching. That's because of the fact that your little muscles are holding your neck up and trying their best to bring you back into alignment. So there are some ways to avoid text neck. One of the easiest ways is to obviously get away from that flexed posture of your cervical spine where you're constantly hunched over. So for the younger population, I tell their parents, you gotta have some text time where you give your kids cell phones for their particular usage for a particular amount of time, and then you take the cell phone away. But for the adults, it's constantly reminding the adults that even though you're working and your work is dependent upon the cell phone, you gotta maintain a good posture, bring the cell phone up towards your eyes, not looking down all the time. If you're working at a computer or a laptop, you gotta make sure it's at an eye level or even higher, or maybe even get a stand-up desk at your workplace so you can stand up and work versus constantly sitting down and being in a flexed posture. It all comes down to a matter of balance. Yes, you have to work. Yes, you have to use your cell phone, and I do too. But at the same time, I understand, and so that's what I tell my patients is, have some balance. Take some time away from your electronic devices. Take some time to exercise, to check your posture, your low back posture. Maybe go see a physical therapist. And even in the gym, you can grab a trainer and just say, hey, why don't you help me figure out some new exercises that can correct my posture? So if you have any issues with neck pain like we discussed, Honor Health has a variety of physical therapist specialists like myself. Please come visit our website and we'll be able to help you.
Every 65 seconds, someone in the U.S. develops Alzheimer's disease. If your memory loss is disrupting your daily life, don't discount it. Get it checked by your doctor. Stick around, we have more to come on your health. How making the right dental choices can impact your life. And see how regenerative therapy could help with your pain. Having dental issues can impact your overall life, and for one patient, he said finding New Day Smile gave him the new outlook on life he was seeking.
My teeth, through my childhood and to adulthood and everything, I always had problems. They were starting to hurt. A lot of the teeth were not functional anymore, so the ongoing process involved taking some out, putting some in. I went through the partial denture process.
Jose came in with ill-fitting partial dentures. He wasn't able to wear his existing prosthesis. It was loose, it would pop off, and his other teeth were hurting.
Following my children's advice, and they said, let's do something, Dad. It's about time, And so I got serious about it, and I went on the internet, and I strolled through a few dentists, and the one that really struck me as being the one I wanted to try was Dr. Valuewise.
So with Jose, we went through a series of options with him. We took a CT scan, a full series of x-rays, a panoramic x-ray, and determined that we could offer him either snap-in dentures or fixed bridges. But after discussing his options with him, he decided to do a full upper denture. He's been very happy with that.
We discussed how it was going to go, Everything was thorough, and I pretty much made up in my mind, just from the detail of our discussion, the way he approached everything and made everything clear and precise. I made up my mind, okay, this is my last stop to a dentist. I found the one that's going to do the job for me.
So a snap-on denture is a denture that, like it says, it will snap in to implants. So the way it works is someone that's already lost all their teeth or is going to lose all their teeth, you prescribe some implants, typically between 2 and 4, ideally 4, okay? Because it'll be more stable. I always give the analogy of a table or a chair. It has 4 legs, it has more stability. The way it works is you place the implants. Once the bone heals, you put attachments on the implants. They're called locator attachments. And then inside the denture, you put something we call housings. Then the denture will simply snap on to these attachments and it stays in the mouth. That way that patients could eat corn on the cob, chew gum, and their dentures are not flopping around. Plus, they don't have to use that gooey adhesive stuff that everybody hates.
As far as the quality of my life, 180-degree turn. It's changed me in all aspects. I think that it gives you confidence, it reassures you, and it makes you feel as though, you just got a new lease in life.
If you suffer from diabetic nerve pain or perhaps a sports injury, your pain could be eliminated without surgery. Let's see how patients are being helped with regenerative therapy.
I just talked to the patient. She's 100% asymptomatic. I mainly treat diseases that are inflammatory of the lower extremity, including diabetic neuropathy, plantar fasciitis, tendon problems, fractures, ulcers that are caused by these different inflammatory conditions. My name is Richard Jacoby. I'm a podiatrist. When a patient first comes in to see me that has an inflammatory disease, whether they call it heel pain, which we know is plantar fasciitis, or hallux valgus, which is a bunion, or synovitis, which is ankle pain, I'm going to address their diet first. I believe that what we're seeing in this office is caused by sugar. It is what you're eating is what's causing the problem. The American diet is absolutely delicious because it has sugar in it. It's a poison. So we're eating a poison, not too much different than arsenic, and it destroys every tissue in your body. It's in my book, Sugar Crush. I outline all of this. It's our diet. It's that simple. The range of motion is good.
I'm a tennis player, and playing tennis on clay, I hurt my foot, quite painful. I was limping and came into Dr. Jacoby, and he correctly diagnosed it. It was a rupture of 2 tendons. He performed surgery and then injected me with stem cells. And 3 weeks later, I was back to playing tennis.
We're using regenerative medical products from perinatal tissue, and that is the tissue of a live birth. From a C-section, taken to a lab, processed, frozen in the FDA lab, and we buy that from there. We inject it locally into the part, under local anesthetic, in the office for the most part. And I'm going to slide you down just a tad, and we'll take a look inside the ankle.
So I have osteonecrosis in both of my ankles and my wrists. My bones die and they become brittle and they're constantly in pain. When I first came to see Dr. Jacoby, so this ankle had already been hurting, and this one I could barely stand or walk on. I had a knee scooter. And he said that he wanted to try stem cell implants in my ankle, and so that's what he did.
The x-ray is completely normal. Your range of motion is completely normal. I cannot see any evidence that you had anything.
I was walking again within 2 weeks. It was less than a month and I was already pain-free, and I couldn't even walk like a month prior. I really wanted to cry, honestly, because I didn't think that this kind of pain could go away.
The results that we have seen are, I use the word miraculous. 80% of the people I see, if they do what I say, will probably not go on to have surgery. Perfect patient to help.
You're a perfect doctor.
When you really think about it, it's God's gift to us. It's natural substance.
Coffee is one of the world's most popular beverages, it's been shown to improve your memory and potentially decrease your risk for dementia. Up to 3 cups of black coffee per day are recommended, so make sure to drink your cup of joe. Stick around, we have more coming up on Your Health. Getting on a path to recovery was a struggle for Izzy, but with the help of Decision Point, she's now on her way to success.
Where I grew up was like, if you can keep doing the stuff you need to do and you can still manage to get messed up, then like it's fine. That lifestyle stayed with me. It was, if I had a good day, I wanted to get drunk. If I had a bad day, I wanted to get drunk. I lived with my good friends at the time, and I guess they got to see me behind closed doors. I kind of tried to play it off like, I'm fine, everything's fine. Like, I didn't want my problems to be like a burden on them or kind of seem like I was like throwing a pity party for myself. They got to see me become like an isolation drinker and disappear kind of inside. Like, people talk about how when they go to treatment, they're like in a shell of themselves, and like that's what it was. They've been talking with Decision Point, and they gave me an intervention, and they said, we can't help you, and like we know you can't help yourself, but like we're taking you to some place that can, and it did. Decision Point has done so much for me. I don't even know where to begin. Their group therapy is awesome. Like, I had never been in that type of a setting before. They wanted me to talk about my problems, and like I've never really had that. My feelings and hardships, they were important, and they made me okay with myself in ways that I had never been even before I started using drugs. I've had friends that were girls my entire life, but it's never reached the level of depth that it did when I was there. A&R was awesome, activities and recreation. They do a really good camping trip. It's a lot of fun. We also did, recovery-oriented exercises. Like, we had time to like kind of meditate in the forest alone. It was just nice to be out of a treatment setting and like being able to enjoy myself and knowing like, oh, this is actually gonna be possible. They set me up for living a life outside of treatment. I still live in Prescott. I go to meetings in my home group. I work at a restaurant here, and I also house manage. I fellowship, and I just surround myself with sober people. It's crazy that like I can wake up and know that I'm capable of living a day, going to work, getting errands done, doing things that I never used to be able to do without either being on something to give me the energy to get through it or drinking something afterwards to reward me. That's something that I never thought that I would have for myself. Thanks to Decision Point, I've been sober for 16 months.
Another way to show your brain some love is to eat a healthy and balanced diet that's lower in fat and higher in fruits and vegetables to help reduce the risk of cognitive decline. Some research shows that the Mediterranean diet is a great option. Stick around, we have more to come on Your Health. For nearly 150 years, Valuewise Health Foundation has consistently stepped up to address the most critical health needs for the people of Arizona. Let's take a look at what they do.
A lot of people know us as Maricopa Integrated Health System or Maricopa Medical Center. Your grandpa probably called us County, but our new name is Valuewise Health. But it's with the same mission: exceptional care, without exception, every patient, every time. My name is Nate Lowry. I'm CEO of the Valuewise Health Foundation. The Valuewise Health Foundation is the nonprofit arm of our community public health care system, and what we're up to is serving the most critical needs of our community here in the Valley. In a lot of ways, we're the community hub. And so we see people oftentimes when they can't find care anywhere else.
The Valuewise Health Foundation is supporting our Arizona Burn Center, which is a leading burn center in the country. We're the second busiest burn center with over 6,000 patients each year. From small burns to large surface area, third and fourth degree burns, we are really leading the way in research. And it's something that the foundation is so honored to support. Valuewise Health is our only public teaching healthcare system here in Maricopa County. We provide training for over 400 physicians every year. Most likely you're a physician trained at Valuewise Health. It's a critical component to the economic development of our community and something we are incredibly proud of. The Family Learning Centers at Valuewise Health are one of the critical components to engaging in healthcare. So you can leave a physician's visit and be connected with a prescription to come in and learn about a new diagnosis. Whether your child has just been diagnosed with diabetes, we can provide you the resources in the language that you speak in a familial setting, in a setting where you feel comfortable. There's no judgment here. It doesn't matter your situation. If you're the CEO or if you're a homeless man on the street, you will receive exceptional care here and you'll be treated with dignity and integrity.
Donations to the foundation are important because we can invest in a vision of a healthier community here in the Valley and even beyond. When the director of our burn center calls you and just needs a couple $100s to help pay for an infant's formula to help them heal from a burn, you realize that no amount is too small. And really, if we get together as a community and support this place in whatever amount, it will go a long way for the health of all of us.
Thank you for joining us on Your Health. I'm Erica Cardenas. See you next time.